All right, good morning or good afternoon, everyone, wherever you're calling in from. Welcome to this session, 1 hour Prevention Plus Wellness hosted session on multi-level prevention of youth substance use. My name is Dr. Chudley Wirch, and I'm the founder and CEO of Prevention Plus Wellness, located here in beautiful, historic St. Augustine, Florida. If you haven't been here, come on down and visit. I'll show you around. And it is the oldest continuously inhabited European community in America by the Spanish a year or two before Jamestown in New York. Anyway, enough of history. Thank you all for joining us. I know how busy you are. I know it's the beginning of the school system. I know it's a challenge for you to be here. So I so very much appreciate those of you that called in. I know this is a completely filled session. I hope everyone's able to get in, but no worries if, let's say, you couldn't get in because it is filled. I am recording this for you, and everyone who's registered will get a link to this recorded webinar, so you will be able to hear and see the content. And I will send everybody who's registered the slides, these program slides, and you're welcome to share the link and the slides widely with all of your colleagues in your organization, in your region, your state, whatever you'd like. Okay, so this is a brand new webinar. Never presented this before. It's wide ranging in terms of its topics. There's sort of good and bad about hosting and presenting a new webinar for the first time. The bad is that it usually comes off a little bit rough. It's not as slick and flows as well as a presentation I may have presented before. But the good news is that it's new content. So I think if you're interested in prevention, and if you're particularly interested in this notion of multi-level prevention, which is so critically important in our field and in multiple fields, in fact, that I think you'll find this very, very interesting, and you'll have some good take-home information. And I have links to all of the sources of information so you can continue your own studies. All right, I think that's just about all I wanted to say to start out. Let's take a look at the objectives. There's 3 of them today. The first is that we'll be exploring a sampling, and it's a wide-ranging sampling. I just picked out some here and there, some very interesting and different examples of models, strategies, research, and health problems that employ multi-level prevention. Secondly, we're going to look at and review, if you will, the strategic prevention framework, the SPF, which I'm sure many of you are well aware of, SAMHSA's strategic prevention framework. Very briefly, we'll look at that. And a little bit more in depth, the underlying social-ecological model for creating multi-level youth substance use and violence prevention strategies. And thirdly, we're going to examine the Prevention Plus Wellness model of multi-level prevention interventions, which address youth substance use and healthy behavior promotion. So those are our 3 objectives for today. Okay, you ready? We're going to dive in. But first, let me give you a poll. So let's have everybody participate today with a poll. So let me pull that poll up. I'm going to launch it. It's been launched, and it'll get to you momentarily. And let me see how many questions there are. I think it's 3 or 4. I'm looking at it. There's 3 questions. So you may have to scroll down to see all 3 of them. I think 2 of them, you could answer multiple items, and 1 you have to answer just 1 item. So the first question is, which prevention levels do your strategies typically target? And this is multiple choice. You can answer more than 1 item there. Then if you scroll down to item, question number 2, it's how many prevention levels do you usually address? That's just 1 answer to that item. And the third question is, which prevention strategies do you use or plan to use? And so that's a multiple choice item as well. So go ahead, please do participate in this. If you don't participate, then your voice will not be heard, sort of like voting. Very important. Now, I do realize some of you may not be able to do this because you're on listening mode only. That's fine. But for those of you that have an option to poll, to vote, to answer this 3-item, please, we want to hear from you. Go ahead and answer these 3 questions. They're just 3 questions, very interesting questions. We want to hear from you and what you think about it. Right now, we got 68% of the 71% of you now have participated, and 76% is going up. It's awesome. 3 out of 4 of you, 77%. Wow. 79% have responded right now. Almost 8 in 10 of you, and now it's dropped back down to 77 because we got people coming in a little bit late and are responding a little bit late. Now we're over 80%, 82% of you have responded to this poll. That is amazing. I don't think I've ever seen that kind of participation. 85%, you guys are breaking a record. This is awesome. 85% of you prevention specialists are 86% have responded to these 3 items. Thank you, thank you, thank you so much. So I'm going to end this poll. I'm going to let it stay open for just a couple more seconds because we're up to 89%. You know what? We've never gotten up to 90%. I've never seen 90%. 90% is like unheard of in polling of any type. And we're basically at that level with 89%. So thank you guys so much. I'm going to end the polling right now. You guys are wonderful. I'm going to end the poll at 91%. Wow. We're like almost perfect. So let me stop at that point. And I'm going to share the results with you. So they're coming your way. You'll be able to see these in a moment. And I'm going to report to you as well, or at least you'll be able to hear this. So question number 1, which prevention levels do your strategies typically target? Not too surprising. Most of you said the individual youth level, youth or young adult level. 51% of you reported that. And that was followed by, interestingly enough, community social level with 33% and family, peers, relationships with 30%. So the family, peers, relationship, and community level pretty close side by side, about 33%. But the majority of you definitely are providing programs to individual youth. Let's look at number 2. How many prevention levels do you usually address in your organization? And neck and neck, again, it looks like 3 or more with 25%, 2 with 23%. So the news here, the good news is that you are targeting more than one level of prevention. Very important for prevention to be successful, to work at these different levels. That's sort of one of the findings of today's webinar, and we'll look at that more later. Number 3, which prevention strategies do you use or plan to use? So 55% said youth, young adult programs. That's followed by 35% said parent training programs. That's followed by 29% saying media programs. That's followed by 20% saying online programs. So it's that progression from most of you, majority of you, youth programs, then parent programs, then media campaign programs, and then online programs. So thank you so much for sharing that. That gives all of us a little bit better understanding of where everyone's at, what you're doing, and sort of as a opening to our content today. So let's start with this. This is the broadest slide, the broadest information, perhaps the most tangential to the topic, and that is, again, multi-level prevention we're talking about. And this is called the Responsiveness to Intervention, or RTI, multi-level prevention system. Now, this is really about education, prevention of educational problems, behavioral problems. So that's where this is coming from. As you can see under number 1, over the past 10 years or so, this model, this RTI model, responsiveness to intervention model, has become increasingly popular among educators as a means to transforming schooling into multi-level prevention systems. And that is, again, academically speaking primarily. So most agree that it's number two, potential for strengthening schooling and heavy demand on practitioners. And you can see the three features that are sometimes used in this RTI model of multi-level schooling, and that is under number 3A, multi-stage screening to identify risk. That is, educational risk, learning disabilities, et cetera. 2, multi-stage assessment and determination of appropriate levels of instruction for individual youth. And then ABC, 1, 2, 3, a role for special education that supports prevention. So, and there's a link there if you want to learn more about this RTI model. So again, little off from the substance abuse, mental health, but it all integrates. It all is related. It's all associated, interacts, academics, learning abilities, family situations, all these things interact. And my wife and I have had many conversations about this because she just retired as 25 years after being a special educator. Many discussions between us about how her students, even at the elementary school level, first, second, third, fourth, fifth grade, they were able to identify learning, emotional, other problems with youth that made them at higher risk for substance use and problems later on in life, not just academic failure, but other things as well, substance use, other problems, suicide, violence, et cetera. So it's all integrated. So that's why I wanted to show you this particularly broad responsiveness to intervention model. Now, honing in a little bit more closely to what most of you are probably engaged in, and that is specific health behaviors. Here's a document on multi-tiered systems support, MTSS. The focus is on, in this particular example, bullying, but it could be used in other examples. So this MTSS framework includes school-based interventions and services. So a little bit more narrowly focused school-based and different levels of support within the school, addressing a range of learning, mental health, and emotional behavioral health concerns of students. And as I said, this example here I'm showing you is focused on bullying, in particular bullying prevention. This is a multi-tiered service delivery, and it involves universal as one level, selective as another, and even indicated intervention. So that's the levels, the 3 levels of prevention make up the multi-tiered systems of support model. Here are some of the components of the model that you'll oftentimes see under number 4. Universal screening to identify kids that are at risk for bullying or being bullied, early intervention services for those high-risk kids, collaborative problem solving, progress monitoring of your interventions, and application of interventions to services across different levels of intensity, from, again, universal to selective to indicated. And you can learn more there on that link. I'll be sending you these slides once again, as I mentioned before, so you'll be able to explore these documents and research and so on that I'm discussing very briefly with you today. So this is another example of multi-tiered, multi-level. These are different terminologies, but you're talking about prevention at different levels. Now let's turn our attention to a review of research. This was on multi-level interventions to prevent obesity. So again, these are actual research studies looking at programs, interventions that addressed the prevention of obesity at 2 or more levels. So the complex multi-level causes of obesity, we could say that about any of our health concerns that we address as prevention specialists: substance use, mental health, whether they'll be specific or broad or whatever. Again, multiple levels of risk and protective factors. So this was a review of research on obesity prevention and reduction, and the two findings were under number 3 and 4. Number 3, of the reviewed studies, 4 found significant intervention effects on body mass index or waist circumference, and 2 showed improvements in diet, and 2 showed improvements in physical activity that were interventions that worked at multiple levels. And caveat here to this review of research was that very few of the multi-level interventions included community policy levels, and that's because of the challenges to changing policies and laws and that kind of thing. So at least that's what these authors suspected. And so in conclusion, number 7, these studies highlight the promise of multi-level interventions by preventing and reducing obesity at the population level. So there's some support here for multi-level interventions. Again, these are interventions that have been implemented, more likely addressing the individual level or the relationship level. Here's a fascinating take on multi-level prevention strategies from the CDC, Centers for Disease Control Prevention, addressing COVID-19. We're still in that. We're still addressing COVID-19. It hasn't gone away. It's still around. We still have people becoming infected. I have people in my lives recently, 2 people just found out that they were infected, and we have still people dying from it, sadly. So, but here's multi-level addressing COVID prevention. So according to CDC, the best course of action is to create multi-layered, again, multi-level, multi-layered, multi-tiered, all different terminology for very similar ideas of having prevention at different levels. Number 1 level from the CDC for addressing COVID-19 is promoting healthy behaviors like hand washing and distancing and wearing face coverings. So that's one level, specific individual behaviors. Another level, number 2, is the environmental level, or the physical environmental level, cleaning surfaces, facilities, health facilities, surfaces, that could be our homes, by the way. Air quality, I put in in my home, I put in a filter that does filter out viruses. It's a higher level of filtration, and that offers a little extra protection at the facilities, healthy facilities level. And then 3 other prevention practices. They can include a whole bunch of different things like contact tracing, for example, et cetera. So different levels, according to the CDC, important and essential to addressing COVID-19 and this prevention. Another level here, addressing human trafficking. I said I would show you many different diverse problems being addressed by and promoting the use of multi-level prevention. And here's one addressing human trafficking. And so this, again, also coming from, or being based on, I should say, the Centers for Disease Control Prevention Social-Ecological Model. I know that's the first time I'm bringing this term to you. We're going to look at this in a little bit more detail, the Social-Ecological Model, the SEM model. And that was the model for this particular recommendation for healthcare professionals to target risk factors for human trafficking at multiple levels, thereby expanding the impact and preventing this particular form of exploitation. And so this document focuses on using the social ecological model, showing that there are risk and protective factors at different levels of environment, starting from the most narrow, I guess you'd say, individuals, all the way to the most broad, social level, that there's risk of protective factors. Therefore, prevention should be presented at these different levels. And that's, in this case, addressing human trafficking. Now, let me just mention very briefly, because I would imagine most of you are very familiar with Substance Abuse Mental Health Services, or SAMHSA's Strategic Planning Framework, SPF, because, you know, if you're going to get funding from SAMHSA, if it comes through from the feds, or if it comes through to the state, from the feds to the state to you, you're familiar with this because you have to employ this strategic prevention framework for receipt of your funding. And you know, this is targets multiple social contexts, this whole idea, because the SPF is based on the social-ecological model. So social-ecological model is sort of an underlying framework, conceptual framework for this broad strategic prevention framework. One framework under social-ecological model is sort of a theoretical framework underpinning this practice model, a strategic prevention framework. So number 3, social-ecological model shows how risk protective factors operate across multiple social contexts, including individual, relationships, community, and social. We're going to look at all these. So this is a comprehensive prevention plan, which includes multiple programs and practices operating at multiple settings across multiple domains. So that's where we get this multi-level from, and it's all built in within your SPF framework. You know the 5 steps, you're probably familiar. You assess needs, you review capacity levels of your agency community, you plan to provide your programs at different levels, you implement your programming, your strategies at different levels, and you evaluate their outcomes. That's number 4, 5 steps. And there's a link to a really good guide on this, which I'm sure some of you have seen. If those of you haven't, check it out. Let's take a look a little bit more specifically about the social-ecological model. This is a model that identifies multi-levels for targeting prevention strategies. The assumption here is that multiple levels you have to have prevention at multiple levels, because the problems we address, it doesn't matter if it's substance use or what we saw, human trafficking, bullying, educational outcomes, etc. You know, these problems are complex. They interact with each other, and you have to have multiple levels of prevention strategy. And that's number 2. You know, social-ecological model. You've got, you know, individual behaviors don't occur in a vacuum. There's this broader environment of family and peers and community and school and, you know, broader social laws and policies, etc., all interacting and influencing us as individuals with regard to all types of our behaviors in our life. Each level operates within, is influenced by the next level as part of the theory. And social-ecological model highlights the importance, the critical importance of working across multiple levels to address constellation of factors that address both individuals and population. So it's a very good model. It's been around for quite a while. There's different versions of it, but here's the one that you'll see quite a bit, at least from the SAMHSA perspective. And it goes from the inside, the lowest level, and it goes up. And so it starts with the individual. And of course, there are so many different, you know, each of us individually, there's a lot of factors involved there. You can see there's beliefs and trauma and attitudes and history and I would even say biology. I don't know why that's not mentioned there, but it is addressed other places. So we go from there, and that broadens up to relationships. It could be family and peers, partners, etc., social networks, and then broader to community, schools and neighborhoods, workplaces, organizations, and then societal as the broadest, social and cultural norms and policies and laws, etc. and they overlap and they interact with each other. That's the social ecological model in a, in a picture, if you will. Let's take a look at some examples of the model. So what we're going to look at is we're going to look at a level of a model. We're going to look at some potential risk and protective factors, and then some potential prevention strategies, just to give you a little sense of this. And again, my apologies to those of you who are experts in this particular area, because I know most of you probably have been introduced at least to the social ecological model as well. So level, start with an individual. Some of the risk factors at the second block below the top is genetic predisposition to substance use, prenatal exposure to alcohol, poor impulse control. Those can all be risk factors. There could be more, there could be less. Protective factors could include, of the whole constellation of protective factors, could include positive self-image, self-regulation skills, social competence. So you've got, risk factors and protective factors. We want to reduce the risk factors, increase the protective factors. Some strategies, prevention strategies at this individual level with these risk and protective factors could be one-on-one psychoeducational therapy, social decision-making and decision-making skills training. Those are just a couple of examples of strategies or interventions that could be provided at this individual level. And the same goes at the relationship level. Here's another example. What are some potential risk factors at the relationship level? Parental permissiveness, peer acceptance of heavy drinking. What are some protective factors? Positive parental involvement, peer disapproval of substance use, low peer substance use. What are some strategies at the relationship level? Parent training programs on communicating disapproval of use, peer refusal skills training. Those are a couple of examples. Let's go to the next higher level, community. Some potential risk factors include poor neighborhood safety, law enforcement, permissiveness of underage substance use. Protective factors could include availability of after-school activities, low perceptions of alcohol use among general student population. Strategies may include social marketing campaign to promote positive social norms. So you can see these different levels of prevention: individual, relationship, community, and now the broadest of all, societal. And risk factors can include laws that are favorable to substance use, historical trauma. Protective factors can include limited availability of substances. Strategies may include increased prices or tax on alcohol, raising minimum legal drinking age. Okay, so just to give you some examples of how this works at different levels in terms of different risk and protective factors. Now, let's take one more look at the social ecological model. And this is CDC's take on it and application of it for violence prevention. We were talking earlier about substance use prevention. Now let's look at violence prevention. Same thing, very similar thing, I should say, social ecological model, but applied to a different problem, violence rather than substance use. Again, same thing, whether it's substance use or violence, bullying, or what have you. The notion here is that there's a complex interplay between individual, relationship, community, and societal factors that influence, promote, or retard these particular behaviors and problems at individual and population levels. And these overlapping rings of the model illustrate how factors at one level influence factors at another level. So here's the image that's shown from CDC social ecological model when addressing violence prevention. You got the individual from the left bleeding into relationships, bleeding into community, and influencing and bleeding into societal. Those are the levels of social context. So besides helping clarify the factors, this social ecological model also suggests that prevention of violence, substance use, bullying, obesity, whatever the case may be, it's essential to address multiple levels. That's what the social ecological model suggests, multiple levels of prevention. And so this approach is more likely to sustain prevention efforts over time and to achieve population level impact. And you can learn more about the social ecological model as proposed by CDC for violence prevention by clicking on that link when I send you these slides. Now, lastly, let's take a look at Prevention Plus Wellness model as a multi-level prevention intervention. Prevention Plus Wellness offers multiple levels of substance use prevention, including number 2, individual level, individual youth programs. That's the individual level. Number 3, family level training programs or parent training programs. That's the relationship level, or we could also include that, identify that as environmental level. Number 4 is, I know this is a little confusing, it's actually the 3rd level, multimedia campaigns. That addresses the community level or environmental level. And 5th, which is really the 4th level, I'll go over it with you one more time because it's confusing, online youth tracking programs, which is a technological level. I don't know, that's not mentioned, that's not identified in one of the main contextual levels, but and it may fit across multiple levels, but technology is very important and can influence at the individual level, family level, community level, even social level. So you got these 4 levels that are addressed by Prevention Plus Wellness: individual youth programs, parent programs which address relationships, multimedia programs which address community, and online programs which are technological in nature. They can be provided as universal, selective, and indicated, as many of our providers use them at these different levels of prevention. So you get different levels of strategies, different levels of prevention. And so implementing these multi-level prevention strategies increase the likelihood that the prevention message will be received by young people. If you present it to youth individually in school, boys and girls clubs, sports, whatever, YMCA, it doesn't matter, and they receive it at home from the parent training, or they receive it in their community through a media campaign, this is essential for them to make sure that these youth are hearing these messages. They receive them, they're reinforced, they overlap each other, and that can strengthen prevention messaging and outcomes. Now, the tri-level Prevention Plus Wellness, the first 3 levels are, again, you start with the youth programs. We have youth programs, 45-minute single session youth programs that address alcohol. That's our sport PPW program. We have a program addressing marijuana. That's marijuana PPW. That's Prevention Plus Wellness. Vaping PPW addresses e-cigarettes. Opioid PPW addresses opioid use, obviously. And then we've got in-shape PPW, which also addresses primarily alcohol for young adults. So we've got these specific 45-minute motivational screening brief intervention, individual level interventions. And they can be reinforced and strengthened by providing matching parent training programs and matching PPW media campaigns. So we've got these 3 levels overlapping prevention messaging, and all 3 levels are designed to increase youth awareness of substance use, risks of substance use, importance and benefits, and associated positive self-images of healthy behaviors by presenting positive self-images, positive behavior feedback, increasing motivation for change, and then engaging youth in multi-behavior goal setting to initiate behavior change and increase self-regulation skills, and by doing that, improving multiple health behaviors. So let's take a look at the sequence of implementation of prevention plus wellness programs. Really, it's up to you. But the idea here is you've got these 3 levels. You got the individual youth programs, you got the parent training programs, you got the media campaigns. So the question is how do you implement them, and what's the sequence? Generally, we see that our providers start with the youth programs, and then they support the youth programs with the parent training or the media campaign. But that doesn't mean you can't do it another way around. For example, some of our providers throughout the country and abroad implement the youth programs and the parent programs at the same time. But you can also even initiate your prevention starting with a media campaign, for example. Start with the media campaign, that's the broadest, that goes to the whole community as well as the school. And then you could add on the youth programs and parent programs. So there's no, specific sequence of implementation that we know is more or less effective. So you got a lot of flexibility in implementing these 3 levels of prevention plus wellness strategies: youth programs, parent training, and media campaigns. And again, that 4th level, not to leave it out, is we do have a new goal plan tracking program. This is an online program. So if you implement one of our single session youth programs, the online goal plan tracking program is designed to continue to technologically watch over your youth beyond that lesson, to see if they're going online and recording their daily monitoring of their goal success, and if they're going online to reset goals every week. And you could track this with this goal plan tracking program. So that's going to increase the support for and motivation for youth to continue to monitor health behaviors, to continue the goal set week after week for up to a month after your single session youth program, PPW program, and will increase the likelihood of youth developing self-regulation skills to monitor their own behaviors, to shape their own behaviors, to improve their own healthy habits over time. So we think this goal plan tracking program, which is brand new to us, and so we'll see how it works though, but we think that it has real potential. You log in as the teacher, the youth log in, and then you could track them on a online, and do ensure that they can, and you could remind them to continue to monitor the behaviors and set goals. So let's take a look again, but let's take a look a little bit more specifically at how each of these levels of youth of prevention plus wellness programs work, starting with the youth level. And again, we got sport and in shape, largely alcohol focused, marijuana, vaping, and opioid PPW programs, all single session, implemented in roughly 40 minutes, 55 minutes, depending on which program you're using. And these programs are designed to prevent specific substances, like marijuana focuses largely on cannabis use, but also promoting physical activity, sports, breakfast, nutrition, sleep, stress control. And it does that. These youth programs implement and influence multiple health behaviors in a 3-step process: screening youth for their current health habits to increase their awareness of their substance use and healthy behaviors. Secondly, providing positive feedback of those health behaviors, cueing desired future images of themselves being more fit, healthy, active, successful, if they get a little bit more physical activity, if they eat breakfast more often, if they get a little more sleep, and how substance use interferes or harms those outcomes of those healthy behaviors. And thirdly, multiple behavior goal setting to initiate and maintain behavior change. That's a 3-step process: screening, feedback, goal setting. That's the youth level prevention plus wellness model. Includes a program manual, oftentimes scripted program scripts to just read to youth individually or in a group, show your PowerPoint slides, digital download of all your reproducible materials. So it's a single, you make this purchase, you order these materials, you don't have to continue to buy things, and you can implement this youth program, whether it's sport or marijuana or vaping or opioid PPW programs, to countless young people. That's the youth programs. That's how that works. Now at the next level, the parent family level, we have a sport, a parent program, marijuana, vaping, and opioid PPW programs. So essentially what we've done, we took the youth programs and we translated them into a parent training program, a single session parent training. So you train parents in a single session, PowerPoint driven. And the goal is to get parents to have the knowledge and the skills and the confidence to provide these positive multi-behavior messaging to their youth at home and goal setting at home, which will reinforce what you present to the youth in whatever settings you're providing your youth programs. Does that make sense to everybody? If that doesn't, let me know, send me a chat. And I want to make sure that you understand this, that the youth programs are one thing, parent programs reinforce the youth programs through training youth to provide the same content in a simplified version that you present to youth with your manuals and your scripted content and slides. So that's the parent training program, and you get with it the PowerPoint slides, which have notes in them to help you present this to your parents in a single session, and as well as directions, as well as the parent handout, which is really important so that the parents have something to take home to practice, to remind them with their youth. That's the parent program. That's the relationship level. So you got the individual youth level, youth programs, prevention plus wellness programs. You got the relationship level with the parent family programs. And now the broadest level of all, community level, you've got the media campaign. So media campaigns, it depends on which media campaign you have. We got one that addresses alcohol or that reflects sport, one that addresses marijuana, one that addresses e-cigarettes, one that addresses opioid. So for example, the marijuana prevention plus wellness media campaign. And depending on which of these media campaigns, you can see under number one, they address a whole lot of things here. Correcting myths, misconceptions, addressing and correcting norms about substance use. So obviously, if you're using the marijuana media campaign, the substance use norms that are being targeted are marijuana, cannabis norms. Increase awareness of substance use harm. Media influences, everybody needs to know about those, particularly young people. Improves knowledge about how to identify signs of use. That's really important to parents and even employers. Provide positive youth and adult role models. Enhance positive self-identity among youth. Have youth complete goal setting. So you can see the same model and strategies that are used in the PPW youth programs, parent programs are also found in the media campaigns, but broader than that. Under number two, for example, the content comes from the youth programs, but it also comes from a whole bunch of other evidence-informed sites like Centers for Disease Control and SAMHSA. So you get a whole bunch of materials in the community level media campaigns from Prevention Plus Wellness, print materials, social media materials. You can, the social media, you can give this to your youth group and let them go at it. They're social media experts, let them post, edit, post whatever they want. Instagram, TikTok, whatever, they can go crazy with it. So lots and lots of good materials. You got PowerPoint slides, you've got videos, we've got print materials, banners, and so on, all kinds of content in our community level media campaigns. But the same model, integrating the promotion of healthy behaviors with preventing harmful substance use, and then broader content, myths and norms, and et cetera, all addressed in your media campaigns. You even have evaluation materials. We have evaluation built into all three levels of our programming: pre-post surveys at the community media campaign level, at the individual youth level. Parent level, we just have an evaluation of the parent training. So technology level, this is that fourth level at Prevention Plus Wellness. That's the PPW Goal Plan Tracking Program. This is where teachers, if they want it, and this is a natural thing we hear from a lot of prevention specialists, they implement our one-session programs. They're wonderful. You can get into school settings that are busy for this one-session evidence-based PPW program. But what happens after that? That's what that question is answered with the Goal Plan Tracking Program. What you do is you initiate the program. You have your youth sign in with their email, and then you track them on a daily basis, on a weekly basis. You keep an eye on them. You could remind them if they forgot to set a goal, if they forgot to monitor the behaviors after a couple of days. You stay in communication with them online. It's an online tool to extend your single youth PPW program online with this goal plan tracking program. And the emphasis here is to motivate and support youth to continue to set weekly goals beyond their initial goal that you set with them during your youth PPW lesson. Every week set goals for up to a month later, and every day track their goal success. So you get them to really focus on the goals. So let me just conclude three really important conclusions. Number one, multi-level prevention is found in a whole variety of very different, as you saw, models and strategies for addressing diverse range of youth problems. That's for sure. Number two, the strategic planning framework, and even more to the point, the social-ecological model calls for creating multi-level substance use and violent prevention strategies. And it's been used in many other contexts as well, for obesity, et cetera, as you saw today in the examples that I gave. Lastly, Prevention Plus Wellness model has multi-level prevention interventions addressing youth, specifically at the individual level, parents, training at the relationship level, media campaigns at the community level, and even a technological component, a technological level with an online tracking program. And all of these programs, all PPW programs, can be used at a universal, selective, even indicated level. All right, I'm going to pause at this point. You can learn more about Prevention Plus Wellness on our website. There's actually a link to our catalog of our programs and training. Our actual address of our program is preventionpluswellness.com. That's our email. That's our website, actually. There it is on the right. Request a program sample. Here it is, preventionpluswellness.com. Actually, the whole address is, HTTPS and all that, but preventionpluswellness.com, you'll find it. Go to our website, preventionpluswellness.com, look under resources. We got a whole bunch of free resources for you, as well as you could explore more about our programs and online training, et cetera. There's our phone number here in St. Augustine. If you want to give me a call, 904-472-5022, or you could always email us at info@preventionpluswellness.com. So let's take a look. Thank you so much, by the way. So that didn't go so bad. I think the timing is good. We've got 10 minutes left. Let me see if any of you have any questions or comments, any reactions. Now is your time. Let's listen and hear from you. Please use this as an opportunity to share your knowledge and your expertise with others. Let's take a look at the chat space and see if there's anything here. I pull up the chat space and it's empty. There's nobody has said anything. Come on, write something in there. What do you think? Any questions? Was there anything that I presented that didn't make sense? Do you want me to clarify anything? Do you have any reactions? Okay, so you can also use the Q&A. And here we go. Somebody's from Q&A. How can we find the evidence that supports PPW effectiveness? Great question. The chat's disabled. I don't know about that. I'm sorry to hear that. But even if the chat is disabled, you could use the Q&A. Oh, I see. We got multiple people saying chat's disabled. Well, that may be for certain locations or perhaps abroad. I'm not sure. But anyway, go back to the initial comment. You can go to resources on our website, preventionpluswellness.com, resources, and you could read actual research outcomes from the studies of our individual programs. You could look at a logic model underlying the conceptual logic between implementing our programs and what happens next and the ultimate outcomes of preventing substance use. You could look at all the registries that list our programs as evidence-based. There's a whole bunch of information on our website. Most of it is under resources. Some of it is under About Us, and you'll find lots of support for not just our individual programs, particularly sport and in shape, and even marijuana PPW, but also our broad model. Remember, Prevention Plus Wellness uses a screening and brief intervention model. That's considered evidence-based practices by a whole lot of health agencies like CDC, SAMHSA, and others. Thank you so much. Love the ideas of using youth resources. Training is not reinventing the wheel. Thank you so much, Christine, for that. Let's see, Anonymous, do we get a certificate today? Anonymous, yes, you do get a certificate. I'm going to send everybody who's registered a link to this recorded training, the slides, and if you've been live and watched this, there's also a certificate, 1 hour CEU for that. So thank you for asking that. What is the website one more time? preventionpluswellness.com. preventionpluswellness.com. Or you can email us info at preventionpluswellness.com. Can we get a copy of the PP presentation? This presentation, you can. You will be getting it from us. Thank you so much. You will all be getting all the things you need to continue to look further. And I'll have to look into why our chat is turned off. That's a little weird, but you know, they're constantly changing. Zoom is constantly changing, like all these online tools. So maybe I have to turn it on now. So anything else? Last chance to ask any questions, any comments, anything was unclear. The comments that were made were great. I thank you for asking it. Thank you for thanking me. It was a pleasure to present this to you. God bless you all for all you do for your youth and your families in your region. If I can help support you in any way, please let us know. Do check out the free resources on our website, preventionpluswellness.com. And it's a setting when you, somebody said, let me go back here. Somebody said, can we get a copy? Thank you. Do you support women? Yes, we support women owner small businesses. We try to do that, but you have to send us some evidence of that. So email us at info@preventionpluswellness.com. And if you have a website, let us look at that, and we could certainly support you to the extent that we can. So thank you for asking that. Might be unable. Yes, that's that. Thank you. Great information. Thank you, Martha. I appreciate that. All of you guys, you're wonderful. Blessings as well to you all. And have a great afternoon. Have a great semester. We'll do some more of these webinars, certainly. Probably at this point, because we're so busy with other things, maybe once a month is what I'm thinking at this point, is what we'll probably be doing. If you have ideas for webinars, as long as it fits our model, integrating healthy behaviors with substance use, let us know. Let us know what you're working on, what you're struggling with, what you're addressing, and we'll certainly see if we can help you in any way. Have a great afternoon, everyone. God bless. Take care. Bye-bye, everyone.